Sorry, Jeanette, can you unmute, please?
Well, that was a rookie mistake. I'm sorry. Thank you, Laura. Before we get started, I just wanted to take a moment to remind everyone listening that this conference is very focused on trauma-informed care. But one of the things that we as caregivers often forget is that we need to pay attention to our own needs as well. We tend to jump into subjects as these at the conference that can be a trigger to bring back trauma that you've experienced in our own lives. We encourage you to do whatever you need to do today to take care of yourself. It's really okay to take a break now and then to pay attention to your own response to these subjects. You have permission to and encouragement to take steps to care for yourself. If you have questions today, be sure to put them in the Zoom chat. Just as a reminder, we will have ASL interpretation today with April and Jennifer, and we also have Spanish translation today. Please refer to Dave Ryder's email of August 19th for instructions. Now I'd like to introduce our first session for the day. Tara Sundem is the co-founder and executive director of Hushabye Nursery, whose mission is to embrace substance-exposed babies and their caregivers with compassionate, evidence-based care that changes the course of their entire lives. What better way to promote trauma-informed care than to share what these families have been able to accomplish when they receive the acceptance and support of this positive environment that Tara has created. Tara will introduce the parents, and we will have time for questions at the end of the presentation, about 10:15. Welcome, Tara.
I almost did your same mistake. Thank you so much, Jeanette, for the introduction. I'm trying to see if I can see all of my families that are on, but just a little bit about Hushabye and where we came from. I'm a neonatal nurse practitioner. In about 2015, we started seeing more and more babies that were coming into our NICU withdrawing, staying in our NICUs for probably a month at least, if not 2, 3. My longest baby was 4 months. And we just knew that we could do a little bit better. We knew that if it was a quiet, dark environment, and if we had better staffing on those days, the babies ended up doing better. You didn't need to give them as much pharmacological support. They just did better. At that time, my only worry was, let's help the babies and not so much the families, which is awful to say, but I just wanted to make it better for the babies. I learned about adverse childhood experiences and immediately was like, oh my gosh, no, now we really need to make this family-centered care and really meet the needs of the parents. I still at that time was like, I don't know what Hushabye Nursery is. I don't know how to do this. I didn't think we were really going to do it until one day. I'm in the nursery, and I was in the East Valley small little nursery, and there was a mom that her baby was exposed to opiates, was having a very hard time. The baby had just fallen asleep, and the mom came in smiling. In this nursery, you walk through the door, and right away, that's where you wash your hands. And she's washing her hands, and the nurse looks at the mom and points at her and says, "Don't touch your baby." And the mom is like washing her hands and just stops. And you see the smile just break. And I'm trying to like make it better after what the nurse really meant was that her baby just fell asleep. We just got them to sleep. They're having a really hard time. Oh my gosh, please don't wake them up. We tried to, I and another nurse tried to make it not so bad. And this mom went and sat by her baby. She sat there for an hour. During that hour, I went up to her and I said, "You're doing so good. The fact that he's sleeping, he must know that you're here. Just stay here. I'm sure when he wakes up, he's going to be so glad that you're here." And baby slept the entire time. At about an hour, that mommy got up, left, gave her baby a kiss, and never, ever returned. With that, we can do better as caregivers, us really realizing that our clients, our moms and dads, are someone else's brother, sister, son, daughter. And we just need to really see them, really know that none of us know their journey. None of us know how someone got here today. And to just pause and know that our words mean a lot and can do a lot, meaning that you can make or break someone. So with that said, I would like to introduce 3 families. Lisa couldn't make it with us today. I found even another person to step in, but she's not feeling well. So we have, I don't know how I'm going to be able to see them. Jeanette, will they just pop up on the screen? You're muted.
Yeah. Dave, I think you're going to have them next to her, aren't you?
Yeah, we'll spotlight.
Okay. So we have Clarissa Collins, and then Julie Adams and Joey Font. All of these parents have been families of Hushabye Nursery, and really have come a long way. They are fighters. They have never given up. And now they are advocates for themselves, for their babies, and now for others. I can't thank all of them enough for jumping on and being part of this webinar.
Thank you.
And Dave, can you get them so I can see them? Sorry. Okay, I see Clarissa, I see you.
I see Clarissa.
If you put it on speaker view, Tara, it should pop up with who's speaking.
Okay, isn't there a way to put all 3 of them on here so I can talk to them, or no?
Right now, I see all of us. I see you 3 at the top, and then Clarissa.
Okay, Joey, I don't see you, but that's all right. It's not a big deal.
Julie.
Okay, so yeah, that's who I see. So, okay, let's just, oh, yay, there you go. Okay, now I see him. So Clarissa, we're going to start with you. Can you tell me a little bit about how, well, let's start this way. With all 3 of you, all of you have struggled with substance use, opiates. When you found out that you were pregnant, what were your first thoughts? 2 words. Clarissa, what were your first things? Or 2 phrases? You're muted if you're going to talk.
No, I'm not.
Okay, go.
My first thoughts were, what is this? What's going on? Am I really gonna do this again? It didn't hit me right away, but I was scared. I didn't know what to expect.
Julie, you're.
Yeah, I was terrified, and I just felt like I was alone. I didn't have the support. I felt super alone and very, very scared, terrified. That's why.
Joey.
Yeah, I think just because of where I was in my addiction at that point in time, I think that the way I handled it was I was like numb to it at first, but then it kind of hit me, and I kept asking myself, am I ready for this? Am I ready for this? And then, the outcome happened, and it's a good thing. But yeah, I don't think I was ready at that time. So
yeah. So Clarissa, you just said, am I really going to do this again? Can you give me a little background about what you mean about again?
So my childhood, I grew up playing competitive golf. I was set up to have a full ride college scholarship and go play college golf, turn pro. That quickly took a left-hand turn when I got pregnant at 16. Shortly after my daughter was born, I started my substance use. No history of substance use before my daughter was born, but situational things happened, and that's where I ended up. Within starting my substance use and having a 3-month-old baby, it didn't go well. It didn't get any better. It just got worse. DCS was then involved. She went with my mom for a little bit, still could not get anything together. And then she was adopted by my cousin, where she lives now in Louisiana. I had put her through some things that I never thought I would ever put myself in, let alone an innocent child. And so I didn't know what to expect. I didn't know, with just being freshly sober, sober when I got pregnant, I didn't know what was going to happen after delivery. I didn't have supports. I didn't have my mom like I did before. My significant other's family is not the most stable. And so it was literally, we were on our own. And I was terrified as to what is my child's life going to look like. I didn't want to make the same mistakes I did with my first.
Yeah. Julie, when you found out you were pregnant and I met you, you were further along. I know you were going to deliver probably in a couple months, maybe a month. Can you tell me about the couple things that you were really worried about, that you were like, oh crap?
Yeah, the fact that, one is I was extreme high risk. I had lost 2 babies before this, which was, with miscarriage. So, obviously I was hoping that, the outcome would be different this time. But then I had the whole aspect of, are they going to take my baby, from me? Because before this I had 2 years sobriety, and I relapsed 2 weeks before I found out I was pregnant. So I was just using for a short time again. And then that's when I found out the methadone. I was like, I don't want to go down this path again. And I got on methadone. I went to the clinic. That's where I found out I was pregnant. Yeah. So I was scared. I didn't know, really what to do. And the whole new, methadone, all of that was brand new to me. So it was a kind of like a sensory overload. There's so much going on.
When you're talking about methadone, tell me about your thoughts before you were prescribed methadone, about when you heard other people were on methadone.
Right. So I had horrible, a bad idea of it. It never even crossed my mind to get on it, because I thought it was just another drug like most other people. I hear that all the time. And today now I know better, but then I didn't. And I just thought, okay, it's just another drug. I don't want to, why would I get on it? It's not for me, kind of thing. And I had only seen people that were still abusing it, because like anything, it can be abused. I'd seen people that were overprescribed, or it just wasn't. And I was like, I would not trade my position for that. You know what I mean? So I didn't have enough information. I feel like I was, completely, just not, I had no idea what it all meant and how it worked or anything.
All right, then we'll send those off to your doctor.
So Julie, how does it work? How do you feel? Number one, are you prescribed methadone now?
Yes.
And how long did it take for you to get to the point that you went, oh my gosh, it actually works?
Within a couple, first of all, right away, obviously I wasn't sick anymore, but I never, felt like, I feel like I didn't even look like what I had seen the people that I thought were on methadone looked like. You know what I mean? I was normal. I didn't know a difference between being on it and didn't, because I did everything to the T, exactly how they told me to do it. I the dose, I did everything that I was supposed to do, was there every day, did all the follow-up stuff. So I feel like it was a completely different idea than what I had in my head and what I had previously seen. And so that's, I felt normal for the first time in a really long time.
And when you say normal, I hear that a lot. Joey, I know that we've talked about that. And every time I hear that, it kind of breaks my heart.
Yeah.
That you say it. But Joey, when you've said it to me, can you describe what that means and what it allows you to do?
What do you mean? Like in terms of, like I said, being a normie?
Yeah.
So like, yeah, let's use that term, right? The term normie. We have this stigma around us as people that have used drugs, right? So what I would call a normie is somebody that hasn't used drugs, right? Or somebody that just hasn't, they just have a normal life, right? They aren't on MAT. They've never done drugs really. They might have experienced it, but they've never been full on blown addicted. They've never had that aspect of their life. That's what I would personally consider a normie.
Yeah.
And yeah, that's
So when we say that, when we talk about, I always say the addiction, the A word. At one time in your life, in all three of your lives, I know that your addiction defined you.
Mhm.
And as you're all like shaking your head, yes. And once you finally got to that point of when you were ready for treatment, right now, if you were to give me 3 descriptors of who you are now, and that can be, anywhere from what you're doing right now, just important things. I'm going to tell you what I am. I'm a mom. I'm a wife. And yeah, I'm a crazy person that started the nonprofit of Hushabye Nursery. Those are my 3 things. Clarissa, what would you say? And this is okay if you start talking about what I told you not to bring up initially.
So first of all, I'm a mom. I'm a fiance, and I now am a certified peer support specialist. And that, like you said before, our addiction defined us. Well, now my role and my job and my life has now redefined who I am.
Yeah. Julie.
Yeah, I'm a mom, a single mom now, which I'm totally okay with. I would say a good friend, and I'm a forensic peer support specialist. So meaning I like go into courts and advocate for people and stuff like that. So I do the same thing, but just I help people every day. So
yeah. And Joey, what are you up to?
I'm a father. I'm a co-parenting father. That can be, like Julie said, she's single. I'm not single. I'm a girl. I'm a boyfriend to a beautiful girl named Felicia, and I'm a peer support, and I enjoy being able to make a difference in people's lives, and I'm more confident than I ever was, period.
Yes.
Yeah.
The
So when you say that, Joey, that you make a difference, that is one thing that everyone, I hope that you're watching this. When I got asked to see if I could find parents that would talk, I was like, oh my God, yes, I can find a whole bunch of parents. When I first started Hushabye, I was like, I don't think I can. I'm not going to put them on stage. I felt that I was using them. And then I had so many moms and dads say, how do I give back? How do I make it that I can make a difference for someone else? How do I make it that when they find out they're pregnant, that it can be a fun time and that we can enjoy this time? And with that, when we're talking about that, Julie, can you talk about when you went to the hospital? We had been done groups, all 3 of them, just so everybody knows, we were doing weekly groups. Julie, I think you did groups a few different places, so 2 or 3 times a week. And in those groups, what we did was teach them about what it's going to look like when their baby is going to withdraw, because they were all being prescribed methadone, what they could do to make it better. And then what was Department of Child Safety going to do? What were they going to say? And I think those are when I meet families, the biggest worry is my baby going to be okay? And number 2 is, I'm going to be able to keep my baby. Those are the biggest things. They want to be able to parent. And so, Julie, just a little bit about how long was your labor? Let's say that first.
So I was in labor for 3 days, like active labor for 3 days. It was, yeah. And I was high risk. So like, I don't know why I can't even say to this day why they didn't just, give me a C-section. But anyways, I was extremely exhausted. Like I was saying, like I felt like I was almost drunk, but I didn't choose to have any other like pain medicine or anything. But during my, my labor was 3 days, and then I finally had her, and I had some complications, like, they had originally thought, but I almost bled to death having my daughter. So it was I was really, really tired afterwards. I mean, I just felt like I was like a walking zombie, literally, for a few days. And then I had to worry about DCS. So
Julie, when DCS came to talk to you, tell me just a little bit about that, because that's always like an anxiety. And anybody DCS workers that are on there, we love you. We appreciate everything that you're doing. Just kind of how it comes from the parents. But Julie, just a little bit about this, because it is interesting.
So my experience, I was in Chandler Regional Hospital, and of course, Hushby was not, the actual building was not there yet. So I did the Eat, Sleep, Console at Chandler, which I was really grateful for. But I stayed, so I got discharged from the hospital, and I went straight to the NICU with my daughter. And since I was discharged, I was not dosed because my clinic had already closed. So I did not actually have my dose of methadone that day. Or I want to say the following day, I had to go get it. So I hadn't even dosed, and the DCS worker came in when I was in the NICU with my daughter and started asking me a million questions. And I hadn't even really slept literally in like 3 days. So I just had my daughter and almost bled to death. And I literally I felt like I was drunk, and I was like, I know that this is really important. I knew that this was going to happen, but I'm not even confident in my ability to speak to you right now, because I'm not going to remember anything that I said. I was like, I can't even spell my own name right now. That's the point of delirium I was at. And some of the, she was kind of investigating or asking some of the other nurses, and they kind of vouched for me, because they were like, no, she's like, she almost was like either, kind of insinuating that I was high, or maybe it was the methadone, the reason I was so tired. And luckily some of the nurses kind of stepped up. And so, my kid's dad and myself, they were just like, no, she literally just had an incredibly difficult labor. She almost died. She hasn't slept, she's worried, like, and so they were there like advocating for me too. And I was trying to like let her know, but the timing of it was just awful. It could have probably gone worse. She was just kind of just being really kind of firm with me and kind of trying to scare me, I felt like. And I was already like, I was just not in a good place at that time to be able to really advocate for myself if I was, just having this conversation right now. I was, imagine, I was like, why does the dose just like, I hadn't slept in, 3 days. I didn't dose. So then she's like, well, maybe it's the methadone that's making her act like that. And I was like, I haven't even dosed. What do you
Yeah. And so I think a lot of that was just not completely understanding,
right.
what you had been through. And, you knew that this was very, very important. This is something that you were worried about the entire time. And it was like, okay, I'm not making a good impression here, but please come back in a day when I can sleep and I can talk with you. I know that after that, how long was DCS involved with you?
So they decided to keep my case open. So I had to have a safety monitor for, I want to say 3 months. And I do remember, I just want to touch on one other thing. I tried to show her, I was like so proud. I was doing all these classes, Tara's in my life, and I got the support finally. And my DCS worker didn't care about any of that. She's like, I don't care about the binder. I don't care all the UAs that you passed. I don't care. She didn't care about none of it. I was like, okay, well then thanks, so, but I just wanted to mention, so they were in my life for 3 months after that. And as soon as I got a new caseworker, then immediately she's like, what are you doing? Like, I'm closing your case immediately. Like you don't really, you're doing everything. You're doing all these classes. You have all this support. Like, I can't offer you anything, and you're doing a great job. And so the investigator and my first caseworker, I don't know why they just didn't, get it, I guess, or I don't know. As soon as I got a new caseworker, she was like, I think it's honestly kind of a waste of my time to be here. So I'm closing your case immediately.
Congratulations. Congratulations. How old is your baby now?
Now she is 2.5. So she was born on December 31st on New Year's Eve. So
She was a little party animal then.
yeah,
And what is her name?
Harmony.
I know her name, but just so
Harmony-
everybody else
Harmony-
knows.
Yeah, Harmony Harper McBride.
Yeah. Clarissa, when you were going into the hospital, what were your worries? What were your concerns?
But my biggest concern was the same thing as Julie's, was is DCS gonna come take her? And is she gonna get to go home? Was all of this preparation and all of this for nothing? Was I gonna bond with her in the hospital and then have to just hand her over? And even though I wasn't in the same position that I was when DCS was involved with my first, I thought for sure that because I had a remove, I didn't have the rights of my first, I thought for sure that was going to be an automatic removal and I was going to have to fight and fight. But luckily I didn't have the same situation as Julie, and the DCS investigator I got was absolutely amazing. She wanted to see the binder. She actually asked me for advice with another mom that she was working with, like, where do I send her? Like, what did you do? Because it's obviously working. And they closed my case right away. She came to the home check. We signed whatever the infant care plan. And she said, you'll hear from somebody in a month, then we'll send you the letter.
So Clarissa, tell me about that. Tell me about finally finding out that your case was closed.
Yeah, so she told me that I'd hear from somebody in a month. And that month came. I never heard from anybody. I was under the impression they were going to be putting in-home services for like 60 to 90 days. Because that's what she had said. Well, a month goes by, never heard from anybody. Another month goes by, didn't hear from anybody. So now I'm starting to wonder, like, did they close it? Did I miss something? And so I waited after the 90 to 120 days. And I texted my investigator and I said, hey, I don't know if you remember me, but is my case closed or what's the status? Because I haven't heard from anybody. A couple days goes by, she calls me and she's like, I'm so sorry. I closed your case a little bit ago. The letter, I guess, never got mailed out. You're great. You're fine. Don't worry about anything, congratulations.
Yeah. So when you found that out, Clarissa, I mean, I remember you calling me, but what were your feelings when your case was finally closed?
Oh God.
That's exactly it. You don't need to say anymore.
I didn't have to, it wasn't in the back of my mind anymore. And I was a little bit like, well, okay, you really forgot to mail out the letter that I'm holding my breath for, that it's kind of something important that they need to be on top of. But I get it, different departments, things happen, but it was, I could finally breathe. Yeah.
I love it. Love it. So Joey, just a little bit about your experience, your delivery, and then DCS. How about, and also if you could talk a little bit about healthy families for you.
Yeah, I was actually going to bring that up, to be quite frank with you.
Yeah.
So basically how I found out about DCS, right? So how I found out we were pregnant, by the time we got our first visit, we found out we were having a son. My son is a beautiful little boy. He turns 3 on October 2nd. He's doing amazing. And I couldn't ask for anything more. But at that point in time, we walked into the clinic at on Northern and 23rd Ave, CMS, and we saw a little.
And what is that? What is that, Joey? Just for those that don't know.
So it's a methadone clinic. MAT is what I'm on personally. I'm on 60 milligrams of methadone I've been on it since June 23rd, 2019, a couple months before my son was born, two weeks before I met Tara, which changed my life forever. And then, yeah, and I'm still on it, and I've been sober. I had one relapse in between the last 3 years. So I've been sober every day, but like a couple days of the last 3 years. And that's the longest I was sober in a decade. I'm 29 and addiction is real and it happens, right? So we ended up learning about DCS through that program. Hushabye, we seen a little flyer, or somebody in the back clinic mentioned it. They said, hey, on Saturdays you can go do this thing called Hushabye and meet this lady Tara. And we're like, okay, well, what is it? We're pregnant. We'll give it a shot, right? Because we did this tour at St. Joe's Hospital where we gave birth, and it wasn't the funnest thing ever. We did this baby class or something like that.
And what do you mean by that, Joey? Like, I'd like, and I don't know what you're really going to say, but what was the difference of the environment of St. Joe's? Because they're doing a great job there, but why did you not feel comfortable?
Yeah, no, it's not that I didn't feel comfortable. It's just that when I got in, I was already in my methadone clinic. Number one, I'm comfortable there because I'm a patient there. Number two, I came in the back and I heard all these people talking and laughing, right? And we walk up, we're like 6-7 months pregnant, and you greeted us. And I think there was only a couple moms there and like maybe a couple dads too. And we just had our little meeting, you explained everything. And it was a great awakening experience for us, because we realized at that point, like, hey, you know what? We are sober. We are doing everything we're supposed to do. But unfortunately, we will have a DCS case, even though we're sober and trying to do what we can the best for our child, right? We're both sober. We were sober the same day. We worked it out that way. We went the same day. We went every day. We were diligent about it. And we stuck to Tara's classes, that green binder. We get to the hospital. Let's fast forward a little bit. And we end up giving birth. Unlike Julie, we didn't go 3 days. We were more like 30 to 50 minutes. So it was pretty quick. The doctor goes, let's do a practice push. He lied. That wasn't a practice push. It was a real push. And it was funny because Tara just so happened to be there that day. Maybe it was fate. I don't know what it was, but
Tara, it wasn't on purpose.
Tara was at St. Joe's giving a talk to them, like the board or someone. And I was like, hey, Tara, we're here. Jude just was born. And we didn't even have his name yet. I was like, my son's born. And yeah, she came and she was going to say hi to him, but she didn't end up doing it. But we were in the hospital, and this is where advocating comes in, right? We want to advocate for ourselves. So I don't know if stigma and all that, like there's so many different things with addicts, right? There's the stigma of how someone might view an addict versus if they were a normie. And then there's the other way, right? But I wanted my baby to be okay. And I wanted to advocate for my son. My ex his mother didn't have a C-section. So we were just in our room relaxed, right? It was about 2 days. He scored a 6. I don't know if y'all are aware, but if you score an 8 and above on the, I can't remember the name, but it's
modified Finnegan. You're good though.
There you go. Like my last name with the F. Yeah. Finnegan. The Finnegan test. So if they score 8 and above is when they consider to give your child morphine. And I advocated personally to stay at the hospital. And we were on the edge of getting morphine for my son, and we didn't. And we asked Tara, and we called Tara because it was a lot smaller back then, but she's always been very easy to like reach. It's never been an issue. Like if you're having your baby, you can trust that Tara or somebody, I promise you'll be able to get through to Tara. Someone will get you through to Tara. She'll talk to you if you're at that hospital. That's a fact. No matter how many moms we have, she will be talking to them because she cares about what she does and she loves it. And so Tara said, hey, why don't you do Eat, Sleep, Console, similar to what we do here at Hushabye? And I was like, well, let's give it a shot. And we ended up staying at St. Joe's for, 5 days. And my son was discharged day 6. And he is a healthy young boy, and he's doing amazing now. And if I had not, when I dealt with DCS, what happened in the hospital was to get discharged. I'm sure you're all aware. If you're not aware, you need to be cleared by DCS. They come to house and they check for safe sleeping environment, clothing, diapers. Can you provide all these things, right? This is something, we've all 3 personally dealt with, and we deal with this on a daily basis, right? So they checked my stuff, checked my car seat. We got cleared. I took back roads home from St. Joe's. I didn't hop on the freeway with my son. I took back roads the whole way. He was just this little 5-pound baby. You know, I'm like, he's so fragile. I didn't change his diaper once in the hospital. I was just nervous. I was a new dad, right? You know, and so we ended up getting him home and everything. But so what happened with DCS after they cleared us is my case was closed he was born October 2nd, 2019. And my case was closed. I believe I still have it. Like, I should frame it. No, I'm just kidding. But I still have it. But no, it was February or January is when it was closed. And it was a relief. It was like, you know, and I was also doing Healthy Families too, which I can't speak highly enough of Healthy Families, which I don't know if any of you are in here from Healthy Families, but that is such a great organization. Tara recommended that I do it. I got an amazing person a lady named Rochelle. And I looked at her as like a mother figure. She was so great to us with Healthy Families. She always brought these little cool things, little cool gifts. Like during COVID, she helped us out with rent, like little things like that just like they touch you. And then like I noticed within 6 months to a year, my life just started constantly changing for the better. Right? Like as I kept doing good and raising my son, my life changed. I.e. now look fast forward. I went back to college and got my degree. I got my bachelor's in exercise and wellness. I completed my internship. I have my son. He's a beautiful young boy. He's almost 3 years old. I have a great and amazing job right now that I love more than anything. And my life is just the best it can get. So I appreciate you for that question.
So now for all three of you, you're all working with families or clients that are struggling and they're new to the recovery. And what's been the most surprising or impactful thing that you've done so far in your new position, Clarissa?
I guess the most impactful thing would be walking with them step by step. If I truly believe that if I would have had somebody like me be there for me no matter what throughout my not even the pregnancy with my first, but throughout the DCS case, throughout the recovery, if I would have had that person, I believe that things would have been different. But because I felt so alone, they were just go to this program, go to this program, go to this program, but you don't have a connection with one person that you truly know has been there. And I've seen it help so many different moms, and being able to see them graduate from treatment, get their DCS case closed, they're able to take baby home without a responsible adult, or we're able to get them to the right split dose so that they can stop using at night because of the way their body metabolizes, and they're finally able to get that clean drug screen. To see them change and see their success, it's so rewarding.
Yeah.
It's why I do what I do.
Yeah. Thank you for sharing that. And can you give from when you get told, Clarissa, here's a new mom, please reach out to her. What does that look like when you're doing that? And how do the families feel?
So when I get a new mom, I call them, see if I can get them on the phone, let them know a little bit about myself, and kind of take down the barrier of, I'm not just a clinician who hasn't been through what you're going through. I'm not just a person who went to school and has a degree. I have been homeless on the streets, using behind a bush, sleeping in broken down motorhomes on Christmas Day. I've been there where they're at. And so showing that right off the bat kind of brings down those walls right away. And I'll get the basic information of where are you delivering? Do you have an OB? Are you on MAT? And that's where I start. If they're not engaged in MAT, let's go there. If you're homeless, let's figure out treatment. If you're not there, then let's see if we can do outpatient. Let's just get them on groups first.
And when you're doing that, I think the big thing would be is every time you were just describing that, you said we do this, we do that, we do this. I think that's a biggie for everybody to understand that many of my families, and I'm going to put you back on the spot, Clarissa, don't have any friends. If they do, they were not healthy friends. Family, a lot of times they've done things that family right now just can't do anymore. Clarissa, so during COVID, was it during COVID, I think? You found out you ended up becoming engaged. And when you came to group, what did you say?
I said, I don't know exactly what I said, but I said along the lines of, I'm excited I finally get to have bridesmaids. Like, I'm finally in a position where I have people that I could ask to be a bridesmaid, that I would want to be in my wedding, meet my family, and do all of that. I get to have a wedding. I get to be healthy enough to do those normal things like you were talking about earlier. The methadone doesn't make us, we're just normal. You wouldn't know that we're on methadone unless we told you. I don't know if somebody's a diabetic unless they tell me. And it's the same thing. But as soon as you hear, oh, they're on methadone, oh, they're on Suboxone, you instantly change your perspective of us.
Yeah, absolutely. Julie, being a peer support, highs, lows.
I think for me, it's like I knew that I wanted, because I've done makeup for 20 years, and I decided to get out of that and to get into peer support because I needed someone. Like, I didn't have any support. That's probably, I mean, if I did, I would have got sober a lot sooner. So for me, just being able to help people every day, like, fills my cup just as much as I'm sure it fills theirs. Like, it helps with my own recovery. So
Julie, can you go back? Sorry to interrupt, but can you go back and tell us how your struggle started?
yeah, so I was 22 and I had an extra bone in both of my ankles, which is, I know, kind of crazy, but and they were like, I was in a lot of pain, so I had to have a long surgery, 2 different surgeries. I was in a wheelchair for about almost 2 years, about a year and a half total. And so the doctors were just prescribing me a ton of medication. And just like anytime I would get low, I'd call them and they just refill it. And so it didn't, that's kind of how it started. And then I had some other issues going on too, like back pain and stuff like that. And that's really how the addiction got started, was just my doctor prescribing me like copious amounts of narcotics at 22 years old. And I didn't know, what could happen if I took it. I didn't know that substance use disorder, I'd never even heard that term. Opiate use disorder, had no clue what that was. Like, I never thought it was an issue. And it wasn't an issue for God knows how many, I wouldn't say a couple of years. I literally can say I didn't have an addiction. I could take it or leave it. I never got sick. I didn't think about it, obsess about it all the time. And then I remember like thinking about it, like looking back now, that something changed. And I now know that that's probably when the brain disease started. But this is in hindsight, this is me as like a 25-year-old not knowing, what's going on and why things have gotten like, all of a sudden I can't, like, I need this pill or I'm sick. Before it wasn't like that. So, I can look back and kind of, figure it all out now, but I just didn't have enough information, and the doctors were just giving me overprescribing me, way over.
So Julie, when you say that you needed the pill to not get sick, what does that mean?
So like the first thing I would do before even brushing my teeth in the morning, I would take more medicine. Like when I'd sleep through the night, I'd wake up and I would feel sick. I would be sweaty. I would feel like I need to go to the bathroom or throw up, or I just didn't feel, my whole body ached. Like I just felt like I had the flu, times 10. And I woke up like that every day. But it didn't, like I was saying, there was a period of time when I was still on the pills, so I didn't know. I was so much younger then, that I was that I was addicted or becoming dependent. They never described that to me. They didn't say this is the risk. They were just, giving me, they knew that I, was in a lot of pain and had a lot of surgeries and, it in a wheelchair. They're just handing me, pills like candy at that point. So, but when it started becoming a problem was when I knew when I'd wake up, I didn't even want to get out of bed unless my pills were right there.
And so
that
it almost comes down to, so like initially you were taking them for pain, which I mean, not feeling well is that, but I hear it so many times when I had a dad last night actually tell me, he goes, I'm a functioning addict. Again, I don't like the A word. I'm a functioning addict. I can work. I only use to be well. And Joey, what does that mean? I only use to be well. Because it's like you use, that can't make you well.
Yeah. So at the end of my addiction, maybe honestly, throughout most of my addiction, I would say using to be well. It's this never ending loop, right? So you wake up sick, you use, then you're not sick, but then it wears off. And then you kind of start feeling a little funny. And you get these, flu-like symptoms of, your stomach starts to get really messed up and turning. And you get, all these symptoms start to come on. You get cold sweats, you can have a fever. You just don't feel like yourself. Like when I personally would withdraw, I did not feel like myself. I almost felt like I was uncomfortable in my own body, like uncomfortable in my personal skin. Like it was not a good feeling. And I would go pick up and continue to do so. I did so for 10 years. And I thought, it took me probably 6 years to even realize I have a serious problem. And you know what? I might have been somewhat functioning at some point, but I did drop out of school and things like that. And my life was affected in a bad way. So, yeah, definitely. I think that's a huge thing.
Yeah. I think that's something, everyone in that's on here, unless you're working with families that struggle. And I truly appreciate all of you for being so real, so honest in sharing what you've been through, because I can tell you that there were many groups that we're on group, and I would be like, okay, I'm not judging you guys. Just a second, I got to just pick my jaw up, because I've not heard that before. And then I can remember going to Clarissa, explain that to me, dumb that down. I don't understand it. And then I do appreciate you guys for explaining things to me, because I didn't get it. I do not have opiate use disorder. I don't have substance use disorder, but I didn't understand that you didn't feel well.
That goes back in like being a normie. You know what I mean? Like you just genuinely do not understand how I or these two lovely ladies right here felt, or these babies feel, or like things like that. In the grand scheme of things, it's hard to really understand that. We can explain it to you as flu-like symptom, but until you really were to have experienced it, you really won't know what it is. And it's worse than flu, in my opinion. It's the worst thing ever.
I just want to point out, on top of the physical, we have that mental urge. We've got, I call it the addiction monster, and then the recovery angel I always talk about on your shoulders. When you're sick, you've got, or you're withdrawing, which is what we call dope sick. You've got the addiction monster that comes up, and it's talking in the back of your mind. The only way you're going to get better is if you get well. All you have to do is go do this. Your family can wait. Your daughter can wait. You're not going to enjoy anything until you get well. You can't get sober. You're never going to get sober. This is going to be your life forever. That's what plays in your mind when we're sick. And so that's why a lot of people, including the three of us, every time we tried to get sober, it never worked because we couldn't get through the withdrawal. No matter how bad we wanted to, getting through that 4 or 5 days of brutal physical pain, but mental pain, mental torture almost. And until we got on medication assisted treatment, until myself got on medication assisted treatment, and that withdrawal was able to be taken out of the picture,
Mhm.
I've been doing great. I've had a couple lapses. I've been on methadone since September of 2016. And I've had a couple lapses since then. But
And when you say lapses, I know at Hushabye we always just call them oopsies. And I think that the big thing with that oopsie, and when you say you've been in recovery since 2016, and we're saying we're in recovery, and just to dumb it down for everyone, I kind of think of opiate use disorder, yes, chronic illness, brain disease. I mean, it is their diagnosis. We shouldn't be saying they're addicts. They have opiate use disorder or substance use disorder. It decreases the stigma, which helps families end up trusting us for us to give them the care that they need. But when you have an oopsie, does it mean that you have to completely spiral out of control and lose everything again? And so, Clarissa, when you said you had a lapse or whatever you just called it, what did that look like?
so personally myself, I call them reality checks, because every time they would happen, it was not because I was sick, not because I was withdrawing, but after a certain point of sobriety and we get complacent, we stop doing what we're doing. We stop going to groups. We stop talking to healthy friends. Maybe we miss a day at the clinic, or significant other relapses or something. Every single time they would get less and less. So like my first oopsie, I would actually use. And then I realized instantly, what was that for? I didn't get the rush I was looking for. Now I'm in pain because of not being able to do it successfully. Or now I'm going to fail a drug test at the clinic and now I'm going to lose my privileges. Was that worth that 5 minutes of, oh, that was stupid? No. But for some reason, our brain continues to go there and continues to go there. And every single time I would have a reality check, the last one, it got to where I picked up, I got everything together, and then I shot it down the toilet because I'm like, this is stupid. Like no, I just wasted money. I'm not going to stick a needle in my arm again and make my whole hand bruised. For what? For one time. Yeah. And I didn't get high the last 5 because my medication is working.
Yeah.
And some people need that.
Yeah.
Relapse is a part of recovery. I think it should be lapses are a part of recovery, not relapses. Because the difference between a relapse and a lapse is a relapse, you go back out. You spiral downhill, you're using every day, every 3 days, whatever it is, you're not doing groups, you're not dosing consistently, and you're just on a DGAF. Mm-hmm. But a lapse is
you're good. Keep going.
You use one time or one weekend, and then you're like, oh crap, okay.
How could we happened? Yeah. So if you had advice for anyone, what could we do to help others get treatment? Like what are the behaviors that caregivers need to do to be able to really connect with someone?
The biggest thing I always say is don't say what you might be thinking if it's negative. And try your hardest to control your facial expressions, because there's, even us being trauma informed, we hear something and we instantly go to overdose. Yeah. Even though there's lots of other ways tragedies can happen, when we're in this field, we instantly go to they overdosed. They did it to themselves. Yeah. and we don't give sympathy.
Yeah.
And then,
Julie, whoops, sorry, Clarissa.
no,
Sorry.
go ahead. No,
Sorry.
go ahead.
Julie, what recommendations do you have for us as caregivers to make things for us to help people?
Well, I mean, I think is just like probably education. I mean, I can't say how important it is, which I know, I mean, you guys are all striving to do that even with this meeting. It's just the changing the way that people think, you know, lack of education and just getting on their level. And I think obviously like peer supports are huge because we've been in those situations and maybe they'll accept things coming from us, you know what I mean, versus someone else. But just, you know, educating people, like I just really wish I had known, you know what I mean, that I could possibly have a brain, you know, disease from taking this pill when I was 22 and continually taking it. If I would have known that you know, just educating people, educating your patients or whoever, you need to like really let them know, kind of warn them. You know, if the doctor would have said, Jules or Julie, you take these pills and you know what, you could end up losing everything that ever meant anything to you. You know what I mean? So do you want to do that? You know, you could have a disease of your brain that's going to change the way that you think and function. And you know what I mean? Like, and change you into a completely different person than you are right now. Do you think that I would have taken those pills? Probably not. So I just think just resources and educating people and having that conversation, you know, and
Thank you.
Yeah, I think just showing even maybe MRI scans of somebody's brain that doesn't have opiate use disorder and one that does. So you can physically see the change.
Thank you. Joey, what recommendations or what do you think that we should tell family or tell caregivers that could make things better?
You know, I think I like to start with families by like, you know, obviously finding out if they're sober, right? So a recommendation I have is like, it's hard to, I always say, don't let yourself get complacent, similar to Clarissa said, right? You don't want to get to that point where you're, let's say mom and dad are doing great, they're on methadone, they're doing fine, they've been in groups, then they just kind of drop off the face of earth. And then let's say, for instance, we hear they relapsed or something happens. In my opinion, the best way to prevent that is just like, I wish, like Clarissa said, like, I wish even that I had somebody when I like to stay in touch with. I wish there was peer supports or I knew a peer support in general that could have helped me prevent my personal lapse, I think. And I think to understand that lapses are part of like sobriety and addiction and recovery, that's one thing we want to understand too, but we also don't want to let people get complacent. That's my biggest thing. I would say, don't let yourself get complacent within your recovery, because after you have your child, you might be like, okay, my life's going great. My DCS case was closed. Everything's going good. And then you might get hit up by Jim Bob over there, who you used to know from, you know, Greenway Road or Bell Road, right? And then it just goes south. I say, you know, I always recommend just kind of changing your entire environment and your entire lifestyle once you have your child is the biggest success rates you're going to see, in my opinion.
Thank you. Thank you. At Hushabye, and all of you have taught me like words to say, words not to say, not the shock and awe, you know, when I hear that someone used 2 minutes before delivery. It's really not so much a choice, everyone. They're unwell and they have a chronic illness and they have a brain disease. And if we can take the stigma out and the judginess, families are going to ask for help and we're going to get them to succeed. Joey, meeting you just a few weeks into recovery, and now to see that your peer support. Joey started at Hushabye a little less than 2 months ago, maybe a month ago. And he started with 15 dads on his caseload. He has 50 that he has been able to just meet and help, I don't know how many, to get into recovery. New program, the impact that you guys have all made. When I hear Clarissa, when I hear you talk to moms and giving them tours, I'm always just like, it's crazy. It's amazing. And Julie, you're just beyond. I love just seeing you mentor other moms and dads on groups. And helping them share your story. So I appreciate all of you really just being here. I want to end with this past weekend, Hushabai lost a mom. And I will tell you that everybody's just devastated. And we have a chat, we have a Teams chat that our outpatient team gets on, and we're all like, I thought she was well. And it was Clarissa's mama. And we're like, Clarissa, she was well. I thought she was well. And we immediately, every one of us, went to overdose. And we just were like, oh, she overdosed. How did she not do that? Hey, Joey, will you put yourself on mute? Thank you. We just thought no matter what, she overdosed, had no idea. And not until Clarissa, I had already heard, we got the news from another community partner that she worked with. They had called me. I didn't even ask how she passed away. I told our whole team. I called Clarissa because I knew that she was her peer, cried with her a lot. And then Clarissa called the community partner. And a little bit later, a couple hours later, she puts in the chat, you guys, she passed away from a car accident. She had done a drug screen the day before to be able to see her baby with her dad. And so what I'm trying to say is we all have a long way to go. I'm ending there, Jeanette.
I think that's a great point, Tara. And at the end of the day, I just want everybody to remember, I'm somebody's son, you know, Julie's somebody's daughter, even Tara is somebody's daughter. We're all somebody's child, right? So to put this in perspective, you might not understand addiction, but if in smart recovery, they use a lot of empathy, right? So if you want to be empathetic and try to put yourself in those shoes, what if it was your kid? Like it's hard to really think of it that way. And it's a traumatic thing that just happened, and it really is unfortunate.
Thank you, Joey. And Jeanette, I think you were going to open to questions, or I haven't been able to keep up with the chat.
No, it's okay. I have been watching the chat, and I'm going to be honest with you. Our chat box is overflowing with responses from our audience of just simple gratitude for what you all did today and what you shared. I think we've never had this kind of response to any session we've done. So thank you for your honesty. Thank you for your wisdom. And thank you for sharing that with all of us today. The little couple questions that we had, you guys were, Julie in particular is aces on Zoom, and she just answered the questions. So you guys are ahead of us. So I thank you all so much. And thank God we've got you.
Yeah, you're welcome. And I did see someone say, I wish we had this in Yuma County. All of our groups, my peers, can do everything that they do virtual. Just contact us. We have hushbynursery.org. You can call us at 480-628-7500. We can do everything online and virtually. Yeah, will your baby necessarily come to Hushaby? We might be able to make that happen, but can they get all of their help? Absolutely. We can do it.
We have 5 or 6 right now from Tucson.
Mm-hmm.
See, thank you so much. And Clarissa, thank you for putting all the contact information in the chat. So everyone, you can look there and find out how to contact Clarissa or Tara or any of them. But Tara, Joseph, Clarissa, and Julie, thank you so very much.